Dr. Jeff Harp from Highland Family Medicine is back with us this morning. Doctor, good morning.
Good morning.
The other day we spoke about advance directives and their importance, especially at this time of COVID-19. I want to sort of build off of our conversation, but first, let's remind our viewers what we mean when we talk about advance directives.
So advance directives are basically decisions that we can make about what medical treatment we would want if we were extremely ill or really had stopped living. So there's two major decisions. One is if we stop breathing or our heart stops beating, do we want people to try to bring us back? And we've all seen shows with the electricity and the pumping on the chest and so forth. Do we want that done? And the other is if we have trouble, if we're alive but having trouble breathing, do we want to be on a ventilator, a machine to keep us breathing? There's many other smaller decisions, but those are the two major decisions that need to be made.
And obviously, individuals make these decisions. They put them in writing so that it's clear for doctors what their intentions are, but they can change over time, right?
That is right. So each decision is made at a point in time when a person has a certain health status and maybe facing certain conditions or not, but in the light of a specific condition, people change their mind. Like they might say, oh, given what I know about this disease, I don't want this done or I do want this done. And so that's up to physicians and other healthcare providers to talk with patients and say, okay, this is what you're facing right now. Do you want this decision to be the same? And whenever we admit someone to the hospital, we review this. We say, okay, here you are right now. What are your decisions? Are they the same as before or have you changed them?
What are we learning about advance directives when it comes to COVID-19?
Well, there was recently a study published, actually yesterday, in the, one of the major medical journals, looking at about 6,000 patients in New York City and reviewing what happened to them with COVID disease. The information in that study, and this is just one study again, this is preliminary, showed that about 20% of people died from the disease in the hospital. So of people who needed to be hospitalized, there was a 20% mortality. And of people who were put on a ventilator, more than half did not live through that experience. So this is something that might influence someone making a decision about facing COVID. Some diseases, putting people on a ventilator has a predictable course of improving. COVID, not so much. It seems that once someone needs a ventilator, it's not likely that they're going to be able to make it through the disease alive. So this is, again, needs to be updated, but these are the kind of things that physicians, other healthcare clinicians will be talking to people about as they are facing this COVID disease.
And having this information and this understanding helps make people make an informed decision at that critical time as well, right?
Yes.
All right, Doctor, as always, we appreciate your time. Be well, and we'll talk to you soon.
Thank you.